The mortar round landed 50 meters from the field hospital, sending shockwaves through the makeshift operating room where Dr. Sarah Chen was elbow-deep in a soldier's chest cavity. While every other person in the tent instinctively ducked, Sarah never even flinched. Her hands moved with surgical precision, extracting shrapnel from around a beating heart as explosions thundered outside. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, cause tomorrow I've saved something extra special for you. The same woman who had been ridiculed for fainting during a routine training exercise just months earlier was now performing life-saving surgery while enemy fire rained down around her. This is the story of how perceived weakness became unbreakable strength, and how one moment of courage under fire changed everything. Sarah Chen had dreamed of serving in the military medical corps since she was 12 years old, watching her grandfather's old war documentaries and seeing medics racing across battlefields to save wounded soldiers. At 31, she had finally made it through medical school, completed her surgical residency, and earned her place as a trauma surgeon in the U.S. Army Medical Corps. Standing barely 5 feet 4 inches tall with a slight build, Sarah didn't look like the typical image of a combat surgeon, but her academic record spoke volumes. She had graduated summa cum laude from Johns Hopkins Medical School and completed her trauma surgery residency at one of the busiest emergency departments in Baltimore. Her assignment to Fort Braxton in North Carolina was supposed to be the stepping stone to her deployment dream. The base housed the 47th Combat Support Hospital, a unit that regularly deployed to active combat zones to provide advanced medical care to wounded soldiers. Sarah had specifically requested this assignment, knowing it would give her the best chance to serve where she felt she was needed most. She shared a small apartment off base with her sister Maria, also a nurse, who worked at the civilian hospital in town. Maria had always been protective of her younger sister, worried about Sarah's determination to serve in dangerous places. The first few months at Fort Braxton went smoothly. Sarah quickly established herself as a skilled surgeon, earning respect from her colleagues for her steady hands and encyclopedic knowledge of trauma procedures. Her immediate supervisor, Major Lisa Thompson, was a veteran combat surgeon who had served 3 tours in Afghanistan and 2 in Iraq. Major Thompson recognized Sarah's potential immediately and began mentoring her, sharing stories from the field and preparing her for the realities of combat medicine. Sarah's medical team consisted of Dr. Kevin Walsh, a thoracic surgeon from Boston with a dry sense of humor, Nurse Emma Johnson, a tough former paramedic who had joined the Army after 10 years in civilian emergency services, and medic Tony Garcia, a young soldier from Texas who had an uncanny ability to anticipate what surgeons needed before they acted. The team worked well together, handling everything from training exercises to real emergencies when soldiers were injured during routine operations. The turning point came during a routine training exercise designed to simulate battlefield conditions. The scenario involved multiple casualties arriving simultaneously at a field hospital, with surgical teams required to perform complex procedures while dealing with simulated combat stress. Smoke machines filled the air, speakers blared recordings of gunfire and explosions, and actors playing wounded soldiers screamed and writhed on stretchers. The goal was to prepare medical teams for the psychological pressure of operating in a war zone. Sarah had studied extensively for the exercise, reviewing every possible scenario and practicing her procedures until they were second nature. She felt confident as she scrubbed in for what was supposed to be a simulated surgery on a training mannequin designed to bleed realistic-looking fluid. The mannequin had been programmed to simulate a soldier with multiple gunshot wounds to the abdomen, requiring immediate surgical intervention to locate and repair damaged organs. The moment Sarah made the first incision, something went wrong. The mannequin had been overfilled with the synthetic blood substitute, and when she opened the abdominal cavity, a massive gush of dark red fluid poured out, splashing across her scrubs and pooling on the floor. The combination of the realistic blood, the overwhelming smell of the synthetic fluid, the sounds of simulated combat, and the pressure of being watched by evaluators created a perfect storm. Sarah felt the world start to spin, her vision tunneled, and before she could catch herself she collapsed, fainting right there in the mock operating room. The incident was witnessed by dozens of medical personnel, including several senior officers who were observing the exercise. Among them was Colonel Michael Harrison, the newly appointed chief of medical operations for the base. Colonel Harrison was a career military officer who had worked his way up through the medical corps over 20 years. He was known for his strict adherence to traditional military values and his belief that combat medicine required doctors who could handle anything without showing weakness. When Sarah regained consciousness a few minutes later, she found herself lying on a stretcher while a medic checked her vital signs. Her face burned with embarrassment as she realized what had happened. Major Thompson was there immediately, helping her sit up and asking if she was okay. Sarah tried to explain that it had never happened before, that it was just the combination of factors, but she could see the concern in her mentor's eyes. Colonel Harrison approached the stretcher where Sarah was sitting, his expression stern and disapproving. He introduced himself with a crisp handshake and immediately began questioning her about the incident. His tone was professional but cold, and Sarah could sense his judgment from the moment he spoke. He asked about her medical history, whether she had ever fainted during surgery before, and whether she had any underlying health conditions that might make her unsuitable for deployment. Sarah answered honestly, explaining that she had never experienced anything like this during her medical training or residency, even during the most challenging surgery. She had operated on gunshot victims, car accident survivors, and patients in the most critical conditions without ever showing signs of weakness. The colonel listened with skepticism, taking notes on a clipboard and asking follow-up questions that made it clear he doubted her explanation. The worst part came when Colonel Harrison announced his preliminary assessment in front of the other medical personnel who had gathered around. He stated that any surgeon who couldn't handle the sight of blood in a training exercise clearly wasn't ready for the realities of combat medicine. He suggested that Dr. Chen might be better suited for a position at a stateside hospital where she wouldn't face the pressures of battlefield surgery. The words stung like a physical blow, and Sarah felt tears threatening to form as she realized her dreams of deployment might be ending before they even began. Major Thompson immediately defended Sarah, pointing out her exemplary record and the unique circumstances of the training exercise. She argued that one incident shouldn't define a surgeon's entire career, especially when that surgeon had proven herself capable in real-world emergency situations. But Colonel Harrison seemed unmoved by these arguments, stating that combat medicine required absolute reliability and that there was no room for soldiers who might falter under pressure. The news of Sarah's fainting episode spread through the base like wildfire. Military communities are small, and gossip travels fast, especially when it involves someone falling short of the tough standards expected of combat personnel. Within days, Sarah found herself the subject of whispered conversations and sideways glances. Some of her colleagues were supportive, but others began to question whether she really belonged in a combat medical unit. Kevin Walsh tried to lighten the mood by joking that everyone had embarrassing moments during training, sharing a story about how he had once thrown up on a patient during his first surgery as a resident. Nurse Emma Johnson was more direct, telling Sarah that the whole situation was ridiculous, and that anyone who judged her based on one incident didn't know what they were talking about. But Tony Garcia, the young medic, seemed uncomfortable around her afterward, as if he was worried about being associated with someone who had shown weakness. The incident began to affect Sarah's daily work as well. During routine surgeries, she noticed that other medical personnel watched her more closely, as if waiting for signs that she might falter again. Colonel Harrison made a point of observing her procedures, more frequently than he did with other surgeons, always taking notes and asking probing questions about her comfort level with different types of cases. The constant scrutiny made Sarah second-guess herself, creating a cycle of anxiety that threatened to become a self-fulfilling prophecy. Major Thompson continued to support Sarah, but even she seemed concerned about the mounting pressure. During a private conversation in her office, she explained the reality of military politics and how perception often mattered as much as actual performance. She advised Sarah to keep her head down, focus on her work, and prove herself through consistent excellence. But she also warned that Colonel Harrison seemed determined to find reasons to remove Sarah from consideration for deployment. The situation reached a new low when Sarah overheard a conversation in the hospital cafeteria. Two surgeons from another unit were discussing the upcoming deployment rotations, and one of them mentioned that Colonel Harrison had been telling people that the 47th Combat Support Hospital had a surgeon with a weak stomach who couldn't handle combat conditions. They speculated that she would probably be transferred to a desk job or sent to work at a quiet stateside facility where she wouldn't be put to the test. That evening, Sarah sat in her apartment with her sister Maria, trying to process what was happening to her career. Maria had always been skeptical of Sarah's military ambitions, preferring the stability and predictability of civilian nursing. She suggested that maybe this was a sign that Sarah should consider leaving the military and pursuing a civilian position where she could still help people without dealing with the politics and pressure of military service. But Sarah wasn't ready to give up on her dream. She had worked too hard and sacrificed too much to let one embarrassing moment define her entire career. She knew she had the skills and knowledge to be an excellent combat surgeon, and she was determined to prove it to Colonel Harrison and everyone else who doubted her. The question was whether she would get the chance to demonstrate her capabilities. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel, it means a lot to us. Now back to the story. Before the colonel succeeded in derailing her military medical career. As she lay in bed that night, staring at the ceiling and listening to Maria's gentle snoring in the next room, Sarah made a decision that would change everything. She wasn't going to let Colonel Harrison's prejudices and assumptions destroy her dream. She would find a way to prove herself, no matter what it took. She had no idea that her opportunity would come sooner than expected, and under circumstances that would test not just her medical skills, but her courage, determination and ability to perform under the most extreme pressure imaginable. The foundation had been laid for a conflict that would determine not just Sarah's future, but her fundamental understanding of what it truly meant to be strong. 6 weeks after the training incident, Sarah thought the worst was behind her. She had thrown herself into her work with renewed determination, arriving early every morning and staying late into the evening to review cases and study advanced surgical techniques. Her performance in the operating room had been flawless, and she had successfully completed several complex procedures that showcased her skills. Major Thompson had submitted glowing performance reviews, and Sarah began to hope that Colonel Harrison might reconsider his assessment of her capability. That hope was shattered on a cold Tuesday morning in February when Sarah received a formal memorandum requesting her presence at a medical review board meeting. The document, bearing Colonel Harrison's signature, cited concerns about her psychological fitness for combat deployment, and outlined a series of additional evaluations that would need to be completed before she could be considered for overseas assignment. The language was clinical and bureaucratic, but Sarah could read between the lines. Colonel Harrison was systematically building a case to exclude her from deployment consideration. The first evaluation was a psychological assessment conducted by Dr. Patricia Reynolds, a military psychologist who specialized in fitness for duty evaluations. Dr. Reynolds was professional but thorough, subjecting Sarah to hours of standardized tests, interviews and stress response measurement. Sarah answered every question honestly, explaining the circumstances of the training incident and emphasizing her long-term commitment to military medicine. Reynolds took extensive notes but revealed nothing about her preliminary findings, stating only that a formal report would be submitted to Colonel Harrison within 2 weeks. During this same period, Sarah noticed that her relationship with some of her colleagues began to change in subtle but unmistakable ways. Kevin Walsh remained supportive, but his jokes about the situation became more frequent and less funny, as if he was trying to convince himself as much as others that the whole thing was no big deal. Nurse Emma Johnson started double-checking Sarah's work more often than necessary, claiming it was just routine procedure but clearly responding to unofficial pressure from above. The most painful change came from Tony Garcia, the young medic who had once looked up to Sarah as a mentor. During a particularly challenging surgery to repair a soldier's compound fracture, Tony hesitated before handing Sarah a critical instrument, asking if she was feeling okay, and if she needed a moment to collect herself. The implication was clear, even if it wasn't spoken aloud. The story of her fainting episode had grown in the telling, and people were now watching for any sign that she might falter again. Colonel Harrison's campaign against Sarah's deployment eligibility became more aggressive as the weeks passed. He began scheduling surprise observations of her surgeries, arriving unannounced in the operating room and positioning himself where Sarah could see him taking notes on his ever-present clipboard. His presence created a palpable tension that affected not just Sarah but her entire surgical team. Dr. Walsh later confided that operating under Harrison's scrutiny felt like performing surgery while someone pointed a loaded gun at your head. The psychological evaluation results arrived with devastating conclusions that seemed to confirm Colonel Harrison's worst suspicions. Dr. Reynolds had diagnosed Sarah with a stress-induced vasovagal response with potential for recurrence under high-pressure situations. The report recommended additional psychological counseling and suggested that deployment to a combat zone might not be advisable given the unpredictable nature of her condition. Sarah was stunned by the findings, which seemed to ignore her years of successful surgical practice and focus entirely on a single incident under artificially stressful conditions. Major Thompson was furious when she read the evaluation, pointing out numerous methodological flaws and questioning Dr. Reynolds' conclusion. She argued that the psychological assessment had been biased from the beginning, with Harrison clearly influencing the process to achieve a predetermined outcome. Thompson scheduled a meeting with the base commander, General Patricia Hayes, to formally challenge the evaluation process,
but Hayes was reluctant to override the recommendations of a qualified military psychologist without compelling evidence of procedural misconduct. The situation escalated further when Colonel Harrison announced new protocols for surgical team assignment. Under the guise of optimizing operational readiness, he implemented a rotation system that effectively removed Sarah from the most challenging cases and assigned her primarily to routine procedures that any competent surgeon could handle. When Major Thompson protested, Harrison cited the psychological evaluation and claimed he was acting in Sarah's best interests by reducing her exposure to high-stress situations. Sarah found herself increasingly isolated within the medical unit. Conversation stopped when she entered rooms, and she could feel the weight of constant observation and judgment. Some colleagues tried to maintain normal relationships, but the pressure from Harrison's implicit disapproval made everyone uncomfortable. The colonel had made it clear that associating too closely with a surgeon deemed unfit for deployment might reflect poorly on others' career prospects. The breaking point came during a mass casualty exercise, designed to simulate a terrorist attack on a military convoy. Multiple vehicles had been involved in a simulated explosion, creating dozens of casualties with varying degrees of injury severity. The exercise was meant to test the hospital's ability to handle a sudden influx of critically wounded patients, while maintaining quality care under extreme time pressure. Sarah had been assigned to one of the secondary surgical teams, handling less critical cases while the primary teams dealt with the most severely wounded patients. She was in the middle of treating a simulated chest wound when Colonel Harrison approached her station, accompanied by 2 other senior medical officers, who were observing the exercise. Harrison loudly questioned her technique, suggesting that her suturing method was taking too long and asking whether she felt confident handling even this relatively straightforward procedure. The public humiliation was calculated and deliberate. Harrison's voice carried across the emergency treatment area, ensuring that everyone present could hear his criticism. He suggested that Sarah step aside and allow a more experienced surgeon to take over, claiming that the exercise was too important to risk any complications from hesitant or uncertain medical personnel. The other observers shifted uncomfortably, clearly recognizing the inappropriate nature of Harrison's intervention, but none were willing to challenge a colonel in front of other senior officers. Sarah's hands began to shake as she realized that Harrison was deliberately sabotaging her performance in front of witnesses who would likely be asked to evaluate her fitness for deployment. The stress of constant scrutiny, combined with the public humiliation and the knowledge that her career was being systematically destroyed, created exactly the kind of pressure that Harrison claimed would cause her to falter. She could feel her confidence crumbling as she struggled to maintain her composure while completing the simulated surgery. Major Thompson witnessed the entire confrontation and immediately intervened, pointing out that Dr. Chen's surgical technique was exemplary and that her patient management had been flawless throughout the exercise.
She suggested that Colonel Harrison's interruption was actually creating unnecessary stress and interfering with the educational objectives of the training scenario. Harrison dismissed Thompson's concerns, stating that real combat situations would involve far more pressure and interruptions than anything they could simulate in training. After the exercise, Sarah retreated to an empty supply closet and finally allowed herself to cry. The constant pressure and systematic undermining of her confidence had taken a toll that she was struggling to manage. She began to question whether she really had what it took to serve as a combat surgeon, wondering if Harrison might be right about her psychological fitness for deployment. The doubt was poison, seeping into every aspect of her professional identity and threatening to destroy the confidence she had built over years of successful medical practice. That evening, Maria found Sarah sitting in their apartment, staring blankly at a textbook she wasn't really reading. Her sister had watched the gradual deterioration of Sarah's morale over the past months, and could see that her younger sister was reaching a breaking point. Maria suggested that Sarah consider requesting a transfer to another base or even leaving the military entirely to pursue civilian medicine where she wouldn't have to deal with Harrison's persecution. The suggestion triggered something in Sarah that surprised both sisters. Instead of despair, she felt a surge of anger at the injustice of her situation. She had worked too hard and sacrificed too much to let one biased officer destroy her dreams based on a single incident that had no bearing on her actual surgical capability. She realized that Harrison's campaign against her wasn't really about her fitness for deployment, it was about his need to assert control and eliminate anyone who didn't fit his narrow definition of what a military surgeon should be. Sarah made a decision that night that would change the trajectory of her military career. She wasn't going to accept Harrison's verdict or allow him to drive her out of the service through systematic harassment and professional sabotage. She began documenting every interaction with the colonel, keeping detailed records of his inappropriate interventions and biased evaluations. She researched military regulations regarding equal opportunity and harassment, looking for procedural violations that might support a formal complaint. More importantly, Sarah started reaching out to her network of contacts from medical school and residency training. She discovered that several of her former colleagues had faced similar challenges in male-dominated medical specialties and had successfully overcome them through persistence and strategic advocacy. One friend, Dr. Jennifer Martinez, had faced gender discrimination during her surgical residency and had eventually filed a successful complaint that resulted in significant policy changes at her hospital. Martinez advised Sarah to build a comprehensive case documenting her exemplary performance before the training incident, the biased nature of subsequent evaluations, and the pattern of harassment she had experienced since Colonel Harrison's arrival at the base. She recommended gathering supporting testimony from colleagues who had witnessed inappropriate behavior and collecting evidence of procedural violations that might support a formal complaint through military channels. Sarah also began preparing for the possibility that she might never receive fair treatment at Fort Braxton under Harrison's command. She started researching deployment opportunities with other medical units and exploring the possibility of requesting a transfer to a different base where she might have a fresh start. The thought of leaving Major Thompson and starting over was painful, but Sarah was beginning to understand that staying at Fort Braxton might mean accepting the end of her deployment aspiration. The tension reached a new level when Colonel Harrison announced that deployment assignments for the next rotation would be finalized within the following month. The 47th Combat Support Hospital was scheduled to deploy a surgical team to Forward Operating Base Phoenix in Afghanistan, a posting that represented exactly the kind of combat medicine opportunity Sarah had been preparing for since joining the military. Harrison made it clear that only the most psychologically stable and operationally ready surgeons would be considered for the assignment. During a staff meeting, Harrison outlined the selection criteria for deployment, emphasizing the need for medical personnel who could perform under extreme pressure without any risk of psychological breakdown or performance failure. His eyes lingered on Sarah as he spoke about the critical importance of reliability in combat situations and the devastating consequences that could result from medical personnel who couldn't handle the stress of battlefield conditions. The message was unmistakable. Despite her exemplary surgical record and the support of her immediate supervisor, Sarah was being systematically excluded from consideration for deployment based on a single incident that had occurred during an artificially stressful training exercise. Harrison had successfully used his position and authority to create a narrative that painted her as psychologically unfit for combat service, regardless of evidence to the contrary. Sarah felt the walls closing in around her military career, but she refused to surrender without a fight. She had come too far and worked too hard to let prejudice and bias destroy her dreams of serving as a combat surgeon. The question was whether she would have any opportunity to prove her capabilities before Harrison succeeded in permanently derailing her military aspirations. She had no way of knowing that events were already in motion that would test her skills, courage, and determination in ways she could never have imagined. The deployment list was posted on a Friday afternoon, and Sarah's name was nowhere to be found. After months of exemplary performance and despite Major Thompson's strong recommendations, Colonel Harrison had excluded her from the Afghanistan rotation entirely. Instead, she was assigned to remain at Fort Braxton for an additional 6 months of supplementary training and psychological monitoring. The bureaucratic language couldn't disguise what everyone understood. Sarah was being sidelined indefinitely. Dr. Kevin Walsh was selected for deployment, along with most of the other experienced surgeons in the unit. Even Tony Garcia, despite his relative inexperience, was chosen for the medical support team. As Sarah watched her colleagues celebrate their assignments and begin preparing for deployment, she felt a crushing sense of professional failure. Everything she had worked towards since joining the military seemed to be slipping away, replaced by an indefinite period of supervised routine surgery and mandatory counseling sessions. Major Thompson was livid about the decision and immediately requested a meeting with General Hayes to formally protest Sarah's exclusion from the deployment roster. She presented a comprehensive file documenting Sarah's surgical excellence, including patient outcomes, peer evaluations, and detailed performance metrics that clearly demonstrated her competence. Thompson argued that Harrison's decision was based on personal bias rather than objective assessment of medical capabilities. General Hayes listened to Thompson's presentation with apparent sympathy but ultimately declined to override Colonel Harrison's personnel decision. She explained that deployment assignments were complex determinations involving multiple factors beyond surgical skill, including psychological resilience, unit cohesion, and operational readiness. While she acknowledged Sarah's technical competence, The general stated that questions about her stress response created legitimate concerns about her suitability for combat conditions. Sarah's world began to collapse around her as the reality of her situation became clear. She had been effectively blacklisted from combat deployment based on a single incident that had been blown completely out of proportion. Harrison had successfully used his authority to create a permanent stain on her military record that would follow her throughout her career. The psychological evaluation, the biased observations, and the systematic undermining of her confidence had all been carefully orchestrated to achieve this outcome. The breaking point came during what should have been a routine appendectomy on a young soldier who had developed acute appendicitis during a training exercise. Sarah was performing the surgery with her usual precision when Colonel Harrison entered the operating room unannounced, claiming he needed to observe the procedure for quality assurance purposes. His presence immediately created tension among the surgical team, and Sarah could feel her stress levels rising as she tried to concentrate on the delicate work. Harrison positioned himself directly across from Sarah, watching her every movement with obvious scrutiny. He began asking detailed questions about her technique, second-guessing her decisions, and suggesting alternative approaches that would have been unnecessarily complicated for a straightforward appendectomy. His interference was so disruptive that Nurse Emma Johnson actually stepped between the colonel and the surgical table, firmly requesting that he allow the surgical team to work without interruption. The colonel's response was swift and devastating. He loudly declared that Chen appeared to be struggling with the procedure and suggested that perhaps a more experienced surgeon should take over to ensure patient safety. The accusation was completely unfounded. Sarah's technique had been flawless throughout the surgery, but Harrison's authority gave weight to his word. The other medical personnel in the room shifted uncomfortably, clearly recognizing the inappropriate nature of his intervention, but unwilling to challenge a senior officer directly. Sarah felt her hands begin to tremble as the stress of the confrontation combined with months of accumulated pressure and professional persecution. For a terrifying moment, she experienced the same sensation that had preceded her fainting episode during the training exercise. Her vision began to tunnel, her breathing became shallow, and she could feel her confidence evaporating under Harrison's hostile gaze. The patient's life was in her hands, but the colonel's psychological warfare was threatening to create exactly the kind of performance failure he had been predicting. In that critical moment, something unexpected happened. Instead of succumbing to the pressure, Sarah felt a surge of protective anger toward her patient and fury at Harrison's deliberate sabotage. She realized that the colonel was willing to potentially compromise patient care just to prove his point about her unsuitability for deployment. The recognition of his callous disregard for the soldier on her operating table crystallized her resolve and gave her the strength to push through her stress response. Sarah steadied her hands, took a deep breath, and completed the appendectomy with textbook precision. She removed the inflamed appendix, checked for any complications, and closed the incision with perfect technique. Throughout the remainder of the procedure, she maintained professional composure, despite Harrison's continued presence and occasional critical comment. When the surgery was complete, the patient's vital signs were stable, and the prognosis was excellent. Colonel Harrison left the operating room without acknowledging Sarah's successful completion of the surgery, but his message had been delivered. He had demonstrated his power to disrupt her work and undermine her confidence even during critical medical procedures. The incident left Sarah emotionally drained and professionally demoralized, questioning whether she could continue to function effectively under such hostile conditions. That evening, Sarah sat in her apartment staring at a resignation letter she had begun writing. The document outlined her decision to leave the military and pursue opportunities in civilian medicine where her skills would be valued and her dedication respected. She had reached the conclusion that staying at Fort Braxton under Harrison's command would only lead to further humiliation and professional destruction. The dream of serving as a combat surgeon seemed dead, killed by prejudice and bureaucratic persecution. Maria found her sister hunched over the laptop, typing and deleting the same paragraphs repeatedly. Sarah explained her decision to resign, describing the impossible situation Harrison had created and her growing conviction that she would never receive fair treatment within the military medical system. Maria was both relieved and heartbroken, understanding her sister's need to escape the toxic environment, while mourning the death of dreams that had sustained Sarah for years. As Sarah struggled with the resignation letter, her phone rang with a call that would change everything. Major Thompson's voice was tense with urgency as she explained that an emergency situation had developed that required immediate medical support. A training accident at a remote facility had resulted in multiple casualties,
and the base's surgical team was being deployed immediately to provide emergency treatment. Most of the experienced surgeons were already en route to Afghanistan, leaving the hospitals severely understaffed for a mass casualty event. The accident had occurred during a live-fire exercise, when an ammunition depot had exploded unexpectedly, causing multiple serious injuries among the training personnel. Initial reports indicated at least 12 soldiers with varying degrees of trauma, including severe burns, blast injuries, and penetrating wounds from flying debris. The remote location meant that medical evacuation would take time, and immediate surgical intervention would be critical for saving lives. Colonel Harrison was off base attending a medical conference, leaving Major Thompson as the senior medical officer responsible for coordinating the emergency response. She had already mobilized the available surgical teams, but the scale of the casualties meant that every qualified surgeon would be needed. Despite Harrison's attempts to sideline Sarah, Thompson was invoking emergency medical protocols that superseded normal personnel assignment. Sarah felt a mixture of fear and excitement as she prepared for her first real test under genuine emergency conditions. This wasn't a training exercise with artificial stressors and predetermined outcomes. It was a real crisis, where soldiers' lives hung in the balance. The thought of finally having an opportunity to prove herself under actual combat-like conditions was both terrifying and exhilarating. The helicopter ride to the accident site was Sarah's first taste of military medical evacuation procedure. The aircraft was cramped and noisy, loaded with medical equipment and personnel rushing to provide emergency care. Sarah found herself seated next to Dr. Rebecca Martinez, an experienced emergency physician who had served multiple deployments and understood the pressures of battlefield medicine. Dr. Martinez offered quiet encouragement, reminding Sarah that her surgical skills were exactly what the wounded soldiers would need. As the helicopter approached the accident site, Sarah could see smoke rising from the damaged facility and emergency vehicles scattered across the training area. The scope of the destruction was sobering, with debris scattered over a wide area, and evidence of the massive explosion that had created the casualty. This was her moment of truth, the opportunity to demonstrate that her commitment to military medicine wasn't undermined by a single embarrassing incident during training. The scene that greeted Sarah as she disembarked from the helicopter was unlike anything she had experienced in her medical career. Wounded soldiers were scattered across a makeshift triage area, with medics working frantically to stabilize the most critically injured. The air was filled with the sounds of pain and urgent medical communication as teams worked to assess injuries and prioritize treatment. Sarah felt her training taking over as she surveyed the casualties and began mentally preparing for the surgical challenges ahead. The field hospital had been set up in a large tent adjacent to the accident site, equipped with portable surgical equipment and basic life support systems. The conditions were far from ideal, with limited lighting, makeshift surgical tables, and constant noise from ongoing rescue operations. Sarah realized that this was as close to actual combat medicine as she was likely to experience before deployment, and possibly her only chance to prove that she belonged in the field. Major Thompson quickly briefed the surgical teams on the casualties and their current condition. 3 soldiers required immediate surgery for life-threatening injuries, including a young private with severe abdominal trauma from flying debris, a sergeant with multiple fractures and internal bleeding, and a specialist with critical burns covering 40% of his body. The cases would test every aspect of Sarah's surgical training and her ability to perform under extreme pressure. As Sarah prepared for surgery, she felt the familiar preoperative focus that had sustained her through countless procedures. The chaos around her faded into background noise as she mentally reviewed the surgical protocols for abdominal trauma repair. This was her element, the place where years of training and natural skill combined to create the kind of focused competence that could save lives. The question was whether she could maintain that focus under conditions that would challenge every aspect of her psychological resilience. The moment had arrived for Sarah to discover what she was truly made of, and whether the strength she felt in her operating room at Fort Braxton could survive the harsh realities of emergency medicine in the field. The first patient on Sarah's table was Private Daniel Morrison, 19 years old, from rural Montana, who had been standing near the ammunition depot when the explosion occurred. Shrapnel had torn through his abdomen, creating multiple perforations in his intestines and causing significant internal bleeding. His blood pressure was dropping rapidly despite IV fluids, and his pale complexion indicated he was going into shock. This was exactly the kind of case that required immediate surgical intervention and steady hands under extreme pressure. Sarah approached the makeshift operating table with the same methodical preparation she used in the sterile environment at Fort Braxton, but everything about this situation was different. The lighting was harsh and uneven, casting shadows that made it difficult to see fine detail. The surgical instruments had been hastily sterilized in field conditions, and the constant noise from rescue operations outside created a chaotic atmosphere unlike anything she had experienced in training. As Sarah made her first incision, she discovered that Private Morrison's injuries were even more severe than the initial assessment had indicated. The shrapnel had created a complex pattern of damage throughout his abdominal cavity, requiring careful exploration to identify all the affected organs. His small intestine had been perforated in multiple locations, his spleen was lacerated and bleeding heavily, and there appeared to be damage to his liver that would require immediate attention. The complexity of the case would have been challenging under ideal circumstances, but the field conditions made every aspect of the surgery more difficult. Sarah had to work with limited surgical assistance, basic equipment, and constant awareness that other critically injured soldiers were waiting for treatment. The pressure was enormous, but instead of feeling overwhelmed, Sarah found herself entering a state of intense focus that seemed to shut out all distractions except the patient in front of her. Working with Nurse Emma Johnson and a young medic she had never worked with before, Sarah began the painstaking process of repairing Morrison's damaged organ. She started with the most life-threatening injuries, controlling the bleeding from his spleen and liver, before turning her attention to the multiple intestinal perforation. Each repair required precise suturing techniques and careful attention to tissue viability, work that demanded absolute steadiness and surgical precision. As Sarah worked, she became aware that other medical personnel were watching her performance with intense interest. Word had spread through the medical team about her exclusion from deployment and the questions surrounding her psychological fitness for field surgery. This emergency response was essentially an unplanned test of her abilities under genuine combat-like conditions, and everyone understood that her performance could determine the future of her military medical career. The surgery on Private Morrison took nearly 3 hours, during which Sarah never wavered in her concentration or showed any signs of the stress response that had plagued her during training exercise. She worked with the kind of focused intensity that comes from knowing that another person's life depends entirely on your skill and determination. When she finally completed the last suture and confirmed that Morrison's vital signs were stabilizing, she felt a profound sense of accomplishment that went far beyond professional satisfaction.
Major Thompson had been monitoring Sarah's progress throughout the surgery and was visibly impressed by her performance under extremely challenging conditions. As Morrison was transferred to the recovery area, Thompson approached Sarah with an expression of pride and vindication. She had always believed in Sarah's capabilities, but watching her perform flawlessly under genuine emergency conditions provided powerful evidence that Colonel Harrison's assessment had been fundamentally wrong. The second patient waiting for Sarah's attention was Sergeant Michael Foster, a career soldier with 15 years of service who had been thrown against a concrete wall by the blast. X-rays taken in the field revealed multiple rib fractures, a punctured lung, and internal bleeding that suggested damage to his liver or spleen. Foster was conscious but in severe pain, and his breathing was becoming increasingly labored as fluid accumulated in his chest cavity. Sarah immediately recognized that Foster would require emergency thoracic surgery to address the punctured lung and repair any damage to his internal organs. This type of surgery was particularly challenging because it required working in the confined space of the chest cavity while managing the patient's breathing and circulation. In a hospital setting, she would have had access to specialized equipment and a full surgical team, but the field conditions meant she would have to improvise with limited resources. The thoracic surgery proved to be even more technically demanding than Morrison's abdominal repair. Sarah had to work carefully around Foster's damaged ribs, while identifying and repairing the tear in his lung tissue. The bleeding was coming from multiple small vessels that had been damaged by bone fragments, requiring meticulous identification and cauterization of each bleeding point. The work was slow and precise, with no room for error that might compromise Foster's breathing or circulation. As Sarah worked on Foster's chest, she became aware of increased activity around the medical tent. Radio communications indicated that additional casualties were being transported from a secondary explosion that had occurred during rescue operations. The news created a sense of urgency throughout the medical team, as resources were already stretched thin dealing with the original casualty. Sarah knew that she needed to complete Foster's surgery quickly without compromising the quality of care. The pressure of time constraints and multiple waiting patients would have been overwhelming for many surgeons, but Sarah found that the real-world emergency conditions actually enhanced her focus and decision-making abilities. Unlike the artificial stressors of training exercises, The genuine need to save lives created a clarity of purpose that eliminated all distractions. She worked with smooth efficiency, completing Foster's surgery in record time while maintaining the highest standards of surgical technique. Dr. Rebecca Martinez, who had been observing Sarah's work while managing other casualties, later commented that she had never seen a surgeon maintain such composure and surgical precision under field conditions. Martinez had served multiple combat deployments and understood the psychological pressures that could break even experienced military surgeons. Sarah's performance was particularly impressive because she was operating under the additional stress of professional scrutiny and career uncertainty. The third critical patient was specialist Jennifer Hayes, who had suffered severe burns over 40% of her body when burning fuel from the explosion had splashed across her uniform. Burn surgery was among the most challenging specialties in trauma medicine, requiring not only surgical skill but also extensive knowledge of fluid management, infection control, and long-term wound care. The field conditions made this type of surgery particularly risky because of the difficulty in maintaining sterile conditions and providing adequate post-operative care. Sarah had limited experience with extensive burn injuries, but her surgical training had included rotation through a major burn center where she had worked with some of the best burn surgeons in the country. She understood that Specialist Hayes would require immediate surgical debridement to remove damaged tissue and prevent infection, followed by temporary wound coverage, until she could be evacuated to a specialized burn facility for definitive treatment. The burn surgery required Sarah to work with extreme precision while managing Hayes's pain and preventing shock from fluid loss. The process of removing damaged tissue was both technically challenging and emotionally difficult, as Sarah had to maintain surgical objectivity while treating injuries that were devastating to look at. The work required steady hands and strong emotional resilience, qualities that demonstrated a different kind of psychological fitness than what Harrison had been evaluating. As Sarah worked on Hayes's burns, she realized that she was performing surgery under conditions that were far more stressful and demanding than anything she had encountered during her training or routine hospital work. The combination of field conditions, limited resources, time pressure, and the emotional weight of treating such severe injuries created a level of stress that made her training exercise feigning episodes seem trivial by comparison. Yet she was not only functioning effectively, she was performing at the highest level of her capabilities. The success of Sarah's field surgeries began to attract attention beyond the immediate medical team. Word of her exceptional performance under extreme conditions reached the base command structure, including General Hayes, who had been monitoring the emergency response closely. The general was particularly interested in Sarah's case because of Major Thompson's earlier protests about her exclusion from deployment consideration. During a brief break between surgeries, Sarah received an unexpected visit. Captain Rebecca Foster from the Inspector General's office had been conducting a routine investigation into medical personnel assignments when the emergency occurred. She had heard about Sarah's situation from Major Thompson and had decided to observe the emergency response to gather first-hand information about surgical performance under stress. Captain Foster had been watching Sarah's work throughout the emergency and was documenting her observations for a formal report. She explained that the Inspector General's office had received several complaints about Colonel Harrison's personnel decisions and was conducting a broader investigation into potential bias in medical assignment. Sarah's performance during the emergency was providing crucial evidence that contradicted Harrison's assessment of her psychological fitness for deployment. The revelation that her treatment was part of a larger pattern of problematic decisions by Colonel Harrison was both vindicating and concerning. Sarah learned that other medical personnel had filed complaints about Harrison's leadership style and his tendency to make personnel decisions based on personal preferences, rather than objective qualification. The investigation had been ongoing for several weeks, but Sarah's case was providing some of the most clear-cut evidence of bias and professional misconduct. As the emergency response continued into the evening, Sarah found herself taking on increasingly complex cases that tested every aspect of her surgical training. She performed emergency procedures that she had only read about in textbooks, improvised solutions for problems that had no standard protocols, and maintained surgical precision under conditions that would have challenged the most experienced combat surgeon. Each successful surgery built her confidence and demonstrated capabilities that went far beyond what anyone had expected. The most challenging case came near the end of the emergency response when a helicopter arrived with a soldier who had been injured in the secondary explosion during rescue operation. Corporal James Patterson had been struck by debris that had created a complex skull fracture with brain injury,
requiring immediate neurosurgical intervention to relieve pressure and prevent permanent damage. Sarah had limited neurosurgical experience, but she was the only surgeon available with the skills necessary to attempt the life-saving procedure. The neurosurgery required Sarah to work with extraordinary precision in an area where the slightest mistake could result in permanent disability or death. She had to create a small opening in Patterson's skull to relieve the pressure caused by bleeding and swelling, a procedure that demanded absolute steadiness and perfect technique. The surgery took place under field conditions with minimal assistance and basic equipment, making it one of the most technically challenging procedures she had ever attempted. Throughout the neurosurgery, Sarah maintained the kind of focused concentration that seemed to slow time and eliminate all distractions. She worked with deliberate precision, checking and double-checking every step while monitoring Patterson's vital signs for any indication of complication. The successful completion of the surgery represented not just a medical achievement, but a personal triumph that proved her capabilities under the most extreme conditions imaginable. When the emergency response finally concluded near midnight, Sarah had successfully treated 7 critical patients, performed 6 major surgeries, and saved lives under conditions that would have challenged the most experienced combat surgeon. Her performance had been witnessed by dozens of medical personnel, documented by Captain Foster, and praised by Major Thompson as exemplary emergency medicine. The contrast between her field performance and Harrison's assessment of her psychological fitness was so stark that it raised serious questions about his judgment and motivation. As Sarah finally had a moment to reflect on the day's events, she realized that the emergency had revealed something important about her own capabilities and psychological resilience. Under genuine pressure with real lives at stake, she had not only functioned effectively but had excelled beyond her own expectations. The artificial stressors of training exercises had created problems that disappeared entirely when faced with the authentic challenge of emergency surgery. The aftermath of the emergency response created ripple effects that extended far beyond the successful treatment of the casualties. Within hours of returning to Fort Braxton, Sarah found herself at the center of a completely transformed professional landscape. The documented evidence of her exceptional performance under extreme conditions had fundamentally altered how her colleagues and superiors viewed her capabilities, creating a stark contrast to the narrative that Colonel Harrison had been constructing about her psychological fitness. General Patricia Hayes requested a personal meeting with Sarah the following morning, having received detailed reports about her performance from multiple sources. The general's office was intimidating, with military honors and photographs from decades of service covering the walls, but Hayes herself was surprisingly approachable and genuinely interested in understanding what had transpired during the emergency response. She began the meeting by acknowledging that Sarah's exclusion from deployment consideration appeared to have been premature and potentially unjustified. During the meeting, General Hayes revealed that the Inspector General's investigation into Colonel Harrison's personnel decisions had expanded significantly following the emergency response. Captain Foster's detailed observations of Sarah's surgical performance had provided compelling evidence that directly contradicted Harrison's assessment of her psychological fitness for combat conditions. The general explained that multiple medical personnel had come forward with concerns about Harrison's leadership style and decision-making processes, creating a pattern of behavior that warranted formal review. Sarah learned that her case was not isolated but part of a broader pattern of problematic personnel decisions that had affected several medical officers under Harrison's command. Amanda Rodriguez, a skilled anesthesiologist, had been transferred to a less desirable assignment after questioning Harrison's surgical scheduling decision. Lieutenant Mark Thompson, a combat medic with exemplary field experience, had been denied promotion after refusing to provide false testimony about another medic's performance. The investigation was revealing systematic abuse of authority that went far beyond Sarah's individual situation. The evidence against Colonel Harrison was overwhelming and came from multiple independent sources. Captain Foster had documented not only Sarah's exceptional emergency performance, but also Harrison's history of biased evaluations and inappropriate personnel decisions. Major Thompson had provided extensive documentation of Harrison's interference with medical procedures, and his pattern of undermining qualified personnel based on personal preferences, rather than professional competence. Even some of Harrison's former colleagues from previous assignments had come forward with similar allegations spanning several years. General Hayes informed Sarah that Colonel Harrison was being relieved of his medical command duties effective immediately and would face formal disciplinary proceedings that could result in early retirement or more severe consequences. The general expressed personal regret that Sarah had been subjected to months of professional harassment and assured her that steps were being taken to prevent similar situations in the future. New oversight procedures were being implemented to ensure that personnel decisions were based on objective criteria rather than individual bias. The vindication was swift and comprehensive. Within a week of the emergency response, Sarah received official notification that she was being placed at the top of the deployment list for the next rotation to Afghanistan. The assignment to Forward Operating Base Phoenix represented exactly the kind of combat medicine opportunity she had been seeking since joining the military. Major Thompson would be extending her own deployment to serve as Sarah's supervisor and mentor during her first combat assignment, ensuring continuity of support and professional development. The psychological evaluation that had been used to justify her exclusion from deployment was formally withdrawn from her personnel file after an independent review found multiple procedural violations and evidence of external influence on the evaluation process. Patricia Reynolds, the psychologist who had conducted the assessment, was censured for conducting a biased evaluation and required to undergo additional training on proper assessment procedure. Sarah's official record was amended to reflect her exceptional performance during emergency conditions and her suitability for combat deployment. The transformation in her colleagues' attitudes was immediate and profound. Medical personnel who had previously treated her with suspicion or pity now sought her advice on emergency procedures and surgical techniques. Kevin Walsh, who had witnessed her field surgery performance, became one of her strongest advocates and requested that Sarah be assigned to his surgical team for the upcoming deployment. Even Tony Garcia, the young medic who had become uncomfortable around her after the training incident, apologized for his behavior and asked to be considered for her surgical team. Sarah's reputation extended beyond Fort Braxton as word of her emergency performance spread through military medical networks. She received congratulatory messages from former medical school colleagues, residency supervisors, and even surgeons she had never met who had heard about her field surgery achievement. The story of her triumph over professional persecution resonated with medical personnel throughout the military who had faced similar challenges in their own careers. The most satisfying moment came when Sarah received a formal apology from the Army Medical Command, acknowledging that she had been subjected to unfair treatment and professional discrimination. The apology was accompanied by a commendation for her exceptional performance during emergency conditions and recognition of her dedication to military medicine despite facing significant professional obstacles. The document became part of her permanent record, ensuring that future supervisors would understand her true capabilities and professional character. Preparation for deployment to Afghanistan began immediately, with Sarah receiving specialized training in combat medicine procedures and battlefield trauma care. The training was intensive and demanding, but she approached it with renewed confidence and enthusiasm, knowing that she had already proven herself capable of performing under extreme conditions. The techniques she had improvised during the emergency response became case studies for other medical personnel preparing for combat assignment. Major Thompson served as Sarah's primary mentor during deployment preparation, sharing insights from her own combat experience and helping Sarah understand the unique challenges of providing medical care in a war zone. Thompson expressed deep pride in Sarah's professional growth and personal resilience, noting that the adversity she had overcome had actually made her a stronger and more capable surgeon. The mentoring relationship that had sustained Sarah through her darkest professional moments was now preparing her for the opportunity she had always sought. The deployment to Forward Operating Base Phoenix proved to be everything Sarah had hoped for and more. The medical facility was a sophisticated combat hospital equipped with state-of-the-art surgical equipment and staffed by some of the most experienced military medical personnel in the service. Sarah was assigned to the trauma surgery team responsible for treating the most critically injured soldiers and civilians brought to the facility from across the region. Her first week in Afghanistan was a baptism by fire that would have intimidated most surgeons, but Sarah thrived in the high-pressure environment. She treated soldiers wounded by improvised explosive devices, civilians injured in terrorist attacks, and coalition forces from multiple countries who required emergency surgical intervention. The variety and complexity of cases challenged every aspect of her medical training, while providing the sense of purpose and professional fulfillment that had motivated her military service. The defining moment of Sarah's deployment came during a coordinated attack on a coalition convoy that resulted in mass casualties requiring immediate surgical response. The attack occurred during a sandstorm that prevented medical evacuation helicopters from flying, leaving the forward operating base as the only option for treating critically wounded personnel. Sarah found herself leading a surgical team treating dozens of casualties under conditions that tested the limits of military medical capability. The most challenging case involved a young Afghan girl who had been caught in the crossfire and suffered multiple gunshot wounds to her abdomen and chest. The surgery required extraordinary skill and precision, working around damaged organs while managing massive blood loss and potential complications from her small size and malnutrition. Sarah operated for 6 hours straight, refusing relief from other surgeons and maintaining focus despite explosions and gunfire continuing outside the medical facility. The successful completion of the surgery on the Afghan girl became legendary within the combat medical community. Sarah had performed one of the most technically challenging pediatric trauma surgeries ever documented in a combat zone, working under active fire with limited resources and no possibility of patient evacuation. The case demonstrated not only her surgical excellence, but also her commitment to treating all patients regardless of nationality or circumstance. Colonel Harrison's career ended in disgrace when the Inspector General's investigation concluded with findings of systematic abuse of authority, discrimination and professional misconduct. He was forced into early retirement with a formal reprimand that permanently damaged his military record and eliminated any possibility of civilian employment in medical administration. The investigation also resulted in policy changes designed to prevent similar abuse of authority and ensure that personnel decisions were based on objective qualifications rather than personal bias. The contrast between Harrison's ignominious departure and Sarah's triumphant deployment was noted throughout the military medical community as an example of how merit and dedication ultimately prevail over prejudice and abuse of power. Sarah's story became an inspiration for other medical personnel facing professional challenges, demonstrating that perseverance and excellence could overcome even the most determined efforts at sabotage. 6 months into her deployment, Sarah received notification that she had been selected for promotion to major and assignment as the chief trauma surgeon at a major military medical center upon her return to the United States. The promotion recognized not only her exceptional surgical skills, but also her leadership capabilities and dedication to military medicine under the most challenging conditions. The position would allow her to train the next generation of combat surgeons, while continuing her own professional development. The young soldiers Sarah treated in Afghanistan wrote letters describing her as the surgeon who saved their lives when everyone thought they were beyond help. Families of wounded personnel expressed gratitude for her skill and dedication, noting that their loved ones had received the highest quality medical care despite being thousands of miles from home. Coalition medical personnel requested her assistance with their most challenging cases, recognizing her as one of the most capable trauma surgeons in the theater. When Sarah's deployment ended after 12 months of distinguished service, she returned to the United States as a decorated combat veteran with a reputation for surgical excellence under extreme conditions. Her homecoming was marked by recognition from military leadership and medical colleagues who understood the significance of her professional journey from suspected psychological weakness to proven combat effectiveness. The final vindication came when Sarah was invited to speak at the Army Medical School about trauma surgery and psychological resilience in combat conditions. Her presentation became one of the most requested lectures in the curriculum, inspiring medical students and residents to pursue military service despite the challenges they might face. She emphasized that true strength comes not from never experiencing fear or doubt, but from overcoming those challenges through dedication and perseverance. Sarah's sister Maria, who had watched her struggle through the darkest period of her military career, was present at the medical school presentation and could barely contain her pride as Sarah received a standing ovation from an audience of current and future military medical personnel. The transformation from a surgeon whose career seemed destroyed by a single fainting episode, to a decorated combat veteran speaking to the next generation of military doctors, represented a complete vindication of her capabilities and character. The story of Sarah Chen became a legend within military medical circles, proving that perceived weakness could mask extraordinary strength, and that determination could overcome even the most systematic professional persecution. Her journey from mockery to medal demonstrated that true character reveals itself not in comfortable circumstances, but under the most extreme pressure, where lives hang in the balance and there is no room for anything less than X. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up, just click and check them out.